On WNIN Lawmakers this week, Indiana Senator Vaneta Becker and Indiana Representative Wendy McNamara recap this year's Indiana General Assembly session. And Lieutenant Governor Suzanne joins us to discuss the coronavirus pandemic. That's coming up next. I'm John Gibson, and this is WNIN Lawmakers. Joining me now is Lieutenant Governor Suzanne Crouch. Lieutenant Governor, thank you so much for joining us. Glad you could make it in once again. Your second visit this season. Well, obviously, what everyone is talking about, what everyone is feeling the effects of is the coronavirus. Governor Holcomb announced some steps this week. Can you tell us essentially what the state government is doing regarding the coronavirus?
Oh, absolutely, John, and it's good to be in Evansville in Southwest Indiana. Mm-hmm. At this time, we must be prepared and we must be proactive because we need to be sure that our most vulnerable Hoosiers are protected, mm-hmm. and we need to reduce the spread of the COVID-19. The recommendations that the governor made in his executive order, some people may say are drastic, but we have to act, and we have to act now. And the reason for that is we have to plan as Hoosiers, and we have to act, and we shouldn't panic. Right. Because we are monitoring the situation, we're assessing it on a daily basis, we're following it globally. And John, globally, when you look at the trends, it's those cities and those countries that were decisive and responsive. They're the ones where their growth actually leveled off. It's the ones who took a while to actually put in place action plans. They're the ones who accelerated. So by doing so, you're going to save lives, and Governor Holcomb and I have acted and will act decisively and responsibly in order to save Hoosier lives. Now, those recommendations,
I know some of those recommendations, things like limiting gatherings to 250 people.
Right.
Why is that important?
Because the close contact, the way the COVID-19 is spread is through people, respiratory. So what kind of comes out of your mouth or where that lands and people touch it. So by having small gatherings of people rather than large gatherings of people, we're kind of limiting that exposure to each other. Doesn't mean that if you're in a small gathering, you're safe. You need to practice social distancing, so you need to keep your distance from someone so that those germs don't come into contact with you and that virus is spread.
And we're about 6 feet apart
we
right
are
now.
Perfect. We are perfect.
This is about right, I do believe. Now, the state is also giving a 20-day waiver to schools. It's normally 180 days required.
That is correct.
So you've trimmed 20 days off there. What is the situation for schools? How is the state helping them?
Well, we understand that one size doesn't fit all. And so we are leaving that local decision to the local school boards and superintendents. And they, across the state, are reacting differently based upon, one, do they actually have a reported case in their county? Mm-hmm. What about daycare? What about food? The superintendents are the ones who are going to be able to evaluate and assess their situation and be able to determine what they need to do with their schools to keep their students safe. Mm-hmm. Now, I also want to point out, John, these are our recommendations as of today. Right. And we understand that this situation is going to continue to evolve and change, and we will be monitoring and assessing it, and we will be probably coming out with different recommendations as we move forward. But today, this is where we are.
The economic impact. Before we went on, we were talking a little bit about hotels. Suddenly, no one's staying at hotels in Indianapolis because of events getting canceled.
Sure.
The economic impact, it could be pretty severe. What does the state plan to do about that?
Well, we know there's going to be an economic impact, and that is why the over $2 billion in reserves that the state of Indiana has is so absolutely important and critical, because those are funds that we can look at in terms of offering incentives or in terms of using them to recover from this COVID-19 virus. Unlike our neighboring states who don't have reserves, we're in that position where we're prepared for emergencies like this. We'll take the necessary steps to make sure that we come out of this hole.
All right, Lieutenant Governor Suzanne Crouch, thank you so much for joining us. We'll be in touch, and have a good, stay healthy, I guess is the best advice.
Thank you, John. I'd love to shake your hand, which is very difficult for me, but we aren't going to shake.
Yes, indeed. Thank you very much. We appreciate it.
You're welcome.
Indiana lawmakers wrapped up the 2020 legislative session. A bill on Curtis Hill died while health care measures cleared the General Assembly, and the coronavirus landed in the state. Indiana Public Broadcasting's Brandon Smith reports on the week at the State House.
House lawmakers sought to clear up state law when it comes to Attorney General Curtis Hill, whose law license could be suspended due to groping allegations. A House proposal would have ensured such a suspension would force Hill out of office, but Senate Republicans rejected that measure, saying it's too close to the election. Making healthcare costs lower and more transparent was a priority of both parties this session, and the legislation that ultimately passed is weaker than originally proposed. One bill does set up a database of all healthcare payer claims, which will allow consumers to get an idea of how much they'll pay for a procedure. But another stops short of ending surprise billing, where a patient gets an out-of-network charge at an in-network facility. Instead, customers will know a few days ahead of time such a bill is coming. And GOP leaders say they're confident Governor Eric Holcomb has all the tools needed to combat the coronavirus pandemic. That's as Democratic leaders express frustration at what they say is a lack of guidance from the governor. For Indiana Public Broadcasting, I'm Brandon Smith at the State House.
I'm joined now by Indiana State Senator Vaneta Becker, whose district includes portions of Vanderburgh and Warwick counties, and Indiana State Representative Wendy McNamara, who represents much of Posey County and a section of Vanderburgh County as well. I'd like to thank you both for coming in. What a week it has been. Just on Thursday, Governor Holcomb announced some initiatives to hopefully stem the spread of COVID-19. It included limiting gatherings to less than 250 people, a 20-day waiver on school requirements across the state, limiting visitation to hospitals and jails, and encouraging everyone to practice social distancing. Let's get to your thoughts on these actions, beginning with Senator Becker. Do you agree with those steps that the governor has taken?
Yes, I do. I think he's taking a proactive stance, and I think that will be positive for Hoosiers. And I think what people need to understand is that this particular virus is 10 times more lethal than the normal flu virus. And so we do need to take precautions, and people do need to take it seriously. Hopefully it will all work out in the long run, but I think these measures that he has announced are very positive for Hoosiers and will help to decrease the spread of the virus.
And as we know, the virus, there is no vaccine for it at this point.
That's right.
No cure. It may be a year and a half away from that. Representative Wendy McNamara, your thoughts about the whole situation. You work in the Evansville-Vanderburgh School Corporation. Obviously, it's a big impact on you and your organization.
Yeah, I've spent most of yesterday and most of today having discussions with parents and students and teachers in our attempts to mitigate any spread of the virus. As you know, EVSC's going to go to virtual learning for the next week, and then come spring break, and then they're going to make a decision after that. I'm unique because we are located at Ivy Tech, and they had different rules. So it's been an organizational, and probably the biggest key is communication and accurate communication, not falling prey to what the latest post is on Facebook, hyping up the situation. It's definitely one to be concerned about, but listening to what the governor proposed yesterday, and then also the mayor, county commissioners, and David Smith from EVSC, we are taking a proactive approach, really trying to mitigate this virus and help our community weather.
Yeah, now as Brandon mentioned in his report there, some lawmakers were expressing some concern about how the governor and the state was responding to the pandemic. Was there any talk in the final days of the session about mitigating the financial impacts of it all? Obviously, basketball tournaments have been canceled, schools have been closed, folks are spending a lot more time at home, not going out so much. Were there any talks about that, or any concerns that you have, Representative, about the situation?
I believe that we've responded appropriately, and thankfully the state of Indiana has a budget surplus to help in situations like this, so that we can help pay our bills if necessary. This is uncharted territory for everybody in the United States, and I believe our governor and our legislature has responded accordingly. We are prepared financially because we have taken the proactive steps to be prepared for situations like this. Let's hope that it doesn't continue to damage us financially. I've heard there was a tweet I saw, Indianapolis had lost about $20 million just in revenue alone from the closures of conferences to the closures of the Big Ten.
Right. Senator Becker, let's have you weigh in on this. The economic impact could be pretty severe, right?
It could be. I mean, it's really too soon to tell, but I think we are prepared. We have a very positive surplus for the state of Indiana, and I think we will weather it. We'll just have to see what happens, but I don't want us to overreact or to panic people as well.
All right, well, the session is over. Amidst all this, the General Assembly wrapped up its session this past week. Let's move on to some items that were passed. House Bill 1004, it addressed surprise medical billing. It's headed to the governor. So what did the final version look like? Now, State Representative Becker, I understand you were out sick and
yeah,
I
was,
make a vote. But
yeah.
Your thoughts about the bill?
I worked on this particular piece of legislation a lot because I serve on the Health Committee in the Senate, and you know, they came at the last committee hearing wanting us to put in something that was never passed in any other state, and I think we took the appropriate approach to back away from that. It would have been very detrimental to Deaconess Hospital, to county hospitals, and would have really just left it up to Anthem to decide what to charge, which would not have been positive. But we have several provisions. They will get an estimate. Consumers will have an all payers claims database where they can get estimates from hospitals. They can get information on the cost of several procedures, the most common procedures in a hospital setting. Also, to limit surprise billing, not to completely eliminate it, but to limit it, so that if you have a procedure done, say in a hospital, and you end up with someone such as an anesthesiologist that is outside of your network, you will know ahead of time that this particular person is outside your network.
And at that point, you can make other arrangements?
That's right.
So the bill, Representative McNamara, as Senator Becker mentioned, it creates a healthcare cost database. You voted for it. What did you, what do you think the bill does all it should?
I think it could do more. It definitely is responsive to the needs of the individual constituent. It definitely makes sure that you know what is coming your way. I would suspect probably next session we'll see a little more action on that.
Probably tweak it.
Tweak it.
Tweaks, yes.
Yeah, because I don't think you're trying to balance, I think, a lot of things that can't be balanced in kind of conversations, because when you go to a hospital, you're not just having one person to pay. You have an anesthesiologist, you might have some other specialist here, some other specialist there, and they might have different levels on the pay scale of what their reimbursement is. And trying to work through all of those things probably will need some tweaking, but definitely it is in favor of the constituent. You know, it's a good step forward towards letting people know what to expect.
Yeah, good start. All right, well, let's also talk about another health care bill, Senate Bill 255. The governor signed it. It allows people to buy insulin without a prescription. Once again, you both voted for this measure. What did you like about that one, Representative McNamara?
You know, as we talk about prescription costs and taking things from prescription to being able to get it on the shelf, insulin costs with diabetes rates going up exponentially in the United States, and having access to that just without having to go see a doctor, get a prescription, is going to be a game changer for a lot of people. Several members of my family have diabetes and take insulin. This is going to change the way that they operate, and I think that will make it easier for people on a daily basis who require insulin to survive.
And full disclosure, I am in fact an insulin-dependent diabetic myself. State Senator Becker, I'm guessing you supported this bill as well?
You know, we were one of the few states that still did not allow people to buy insulin over the counter in a pharmacy. So I think this is a positive move, and I think it will also be cheaper, a lot cheaper for them as well.
Right. All right, well, we will see the results of that. Let's move on to a bill that died at the very tail end of the session. It was Senate Bill 178. It was to address what would happen if the Indiana Attorney General lost his law license while in office. A compromise wasn't reached. Do you think the Attorney General should have a valid license the entirety of their time in office, not just when they're elected? In other words, Senator Becker, as we mentioned, that fell apart at the end. What would you like to have seen, and where does it leave us?
Well, you know, at this particular time, he's not been convicted of a crime.
Right.
And it's, you know, the Supreme Court may make a decision on his law license, and state law does require that in order to be Attorney General, that you have to have a law license. He can have his license suspended, but we do not know what or when the Supreme Court will make that decision. Right. And I think we have a convention coming up in June, and to take that decision away from people that are going to the convention, I think would be very short-sighted.
And the convention you're talking about is?
The State Republican Convention on June the 19th and 20th of this year. And that's really where they will pick the candidates to run for Attorney General. And there are other candidates, so if someone decides to challenge him, and he does have people running against him, it will just make that decision up to the delegates to the state convention to decide who the nominee is that they want.
Right. And of course, Attorney General Hill, there have been allegations of sexual misconduct against him. Representative McNamara, does this pretty much leave it up to the convention and the voters in November, as you see it?
It does, but at some point, the legislature will need to act to have some sort of succession plan, regardless going forward, because as currently exists, as she mentioned, state law requires you to have a law license. And if in the foreseeable future we ever have an incident where we don't have an Attorney General with a law license or a suspension of a license, there's no succession plan in there.
And not in this situation, I mean, he could have it suspended for just 30 days, 60 days. So that makes it sort of unclear, I guess, right?
It does, and so we will need to address this at some point. I would definitely expect to see one next year coming back just to try to address the situation, because right now it's kind of vague. There is no coverage of who goes where. Do you promote somebody up? Does the General Assembly replace that person? So we will we'll revisit it next year.
Okay, but we will see what happens next year and between now and then. Let's move on to education. House Bill 1065 allows referendum dollars to be shared with charter schools, among other items. Representative McNamara, you supported the House version back in January. I understand you voted against the final version.
I did.
Can you tell us why you made the change?
Primarily because of the charter language. It was placed in there in the Senate. I believe it was placed in there specifically to help Gary school corporations on a referendum that they have with their charter schools. If that was the intent, then it needed to specifically apply to there. I felt that a blanket application across the state without really having a whole lot of research. It was a second reading amendment, if I'm
With no
correct.
debate or discussion.
And so, you know, I just wasn't comfortable at all saying to my local school corporations on their referendums, if they choose to have them, that you may, if the charter school comes to ask you to be on the referendum with you, share your proceeds with them. That might be fine, you know, in some communities, but I didn't have the opportunity to have any conversations about it, the positives, the negatives, but just too many unleft questions in that regard.
And Senator Becker, as I understand it, you were excused.
I actually voted against
You
that
did, in
amendment.
fact, vote against this
It
one.
came
The
before I left, before I had to go be out sick. But
Okay.
I will tell you that the person that offered this amendment received $50,000 in campaign contributions 2 years ago from the group that was pushing for this. And I don't think that's right. I think it's unethical, and I don't think that our school corporation, we are receiving less money than we received percentage-wise 10 years ago. And I do not think that we should have to share our revenue. Charter schools, in addition to what they already get per student, they receive $750 per student because they don't receive property taxes.
Right.
So I think that, and the biggest concern I have is that there was no debate or discussion where you could actually have the schools or the school board association, principals, teachers to even weigh in on this decision. And that is not good government.
Right, right. So you saw a conflict of interest there.
Very conflict of interest.
Yeah, and as you say, not much debate either, correct?
Right,
Right.
right.
All right, well, let's move on to another measure that's gotten quite a bit of attention. House Bill 1006. It reappeared after being sidelined in January. It says that anyone under 18 needs to get a judge's approval to get married. Representative McNamara, you voted for this measure. Can you tell us why?
Sure, that's what we call a strip and insert type of the bill. When there's a situation or a bill that dies in another committee, you'll find another home for it, and the home was 1006. That bill originally came through Judiciary Committee, which I sit on. It's a reaction to human trafficking. What we are finding with human traffickers, with our marriage age being so low in comparative to other states, people were coming to Indiana to recruit the kids.
My marriage age was 15, is that right?
Yes, we were actually trying to, you know, there were some states as low as 14 and 13. So it's a response to the human trafficking efforts out there to recruit and marry kids and bring them into the human trafficking world. The author of that piece of legislation had a situation in her community about the same thing. The child was 15. The problem is when they got married at 15, the 15-year-old's not emancipated. By virtue of being married to that person, they lose a lot of their rights. So I support it. I support it on the floor when it came up back again in 1006. I agree with any efforts we can make to try to get rid of human trafficking and address those issues.
Senator Becker, do you share those concerns? Do you think this
Absolutely.
was a good bill?
It's a good bill, and we probably should have done it a long time ago.
Yeah. Now, were you? Did you have to take an excuse? Were you out for this particular
No,
vote? You were there. Okay. We seem to have some discrepancies here, but so you were, and you voted for it. All right. Well, let's move on to a couple of other issues that happened. Actually, anything else of note? I mean, as the session has come to an end here, was there anything else that you came away with, Senator Becker?
Well, you know, there was a lot of good legislation. I think the health care was very positive, and also things we did for schools and for teachers. We made the additional requirements for teacher development optional that we put in law last year, and we also took away evaluations, teachers' evaluation as a basis for test scores against their evaluations, so I think that's positive. We also limited any problems as a result of the iLearn. I think we probably ought to just quit testing altogether, but
So this
it
was the
never
hold
seemed to get it
harmless
right.
issue, correct?
Yeah, yeah. So I think it was a very positive session. We also raised the smoking age to 21.
Right.
We have seen a 78% increase in vaping in teenagers between the ages of 17 and 18, just over the last, from 2017 to 2018. So I think it's very positive, and if you can reduce the start of teen smoking, it will reduce the amount, and the adults that we're fourth highest in the nation for smoking.
Also recapping, you mentioned education, of course. One issue that a lot of teachers talk about is still a lack of a pay raise from the state. Do you hope to address that next year? Can you assure teachers that there will be a pay raise next year, Representative McNamara?
They're going to, the governor has commissioned a task force to review teacher pay, to really drill down on why we have some school corporations that are able to give substantial raises and why others cannot.
Right.
Is it because of property taxes? Is it because the way we've structured the funding on our legislative side? I'm curious to find out what it exactly is. So guarantee it, you will see the conversation taking place. I believe June is when that's supposed to come out, June or July.
A summer study committee looking at it, is that right?
No, it's
Or
an
is it
actual
commission?
task force that's meeting to drill down on the
commission,
exact
right.
issues. So I would expect to, if they come up with whatever their findings are, will be things that we will be acting on in the future. But I mean, looking at it from the successes that we did be able to provide for teachers this year, is the big one is decoupling their teacher pay from test scores. That's a huge one. And then one we didn't talk about was allowing teacher training flexibility requirements. But overall, it was a very smooth session, in my opinion. There wasn't too much controversy. Sometimes that usually finds its way to the headlines more often than not.
Sure.
And the other one we didn't necessarily mention is distracted driving.
Yes, the hands-free.
Yeah, the hands-free. That took quite a while to get to the sweet spot, and it'll go into effect now, but there won't be any points on your license until July of 2021. So.
All right. Well, a busy session. We'd like to thank you both for coming in today, Senator Becker, Representative McNamara. We'll see you again next year. We'd like to thank Suzanne Crouch, the Lieutenant Governor, as well. This is the final episode of this year's WNIN Lawmakers. I'm John Gibson. Thank you for joining us, and we will see you next year.